What exactly is the name of Elon Musk's brain implant that he developed? The brain chip company founded by the billionaire entrepreneur is ready to conduct clinical tests on human participants. Musk, together with others, 2016 established Neuralink, has boldly claimed that the technology would enable someone with paralysis to use a smartphone with their thoughts quicker than someone using thumbs. I wondered if receiving an implant in your brain was feasible. Neuralink announces the beginning of human trials for a new brain implant. The industry of brain-computer interface is making rapid strides, and it's not just Neuralink that's contributing to this. The FDA has given Synchron permission to conduct clinical tests on humans, and it's possible that Neuralink won't be too far behind. Hey folks, welcome back to the Future Space. In this video, we are going to find out whether brain implants represent the next step in the evolution of thinking or not. And let us dive in. Neuralink, the brain chip company founded by Elon Musk, is preparing to conduct clinical studies on people. Implants that Musk says have previously been tested on a macaque and a pig, and might one day allow paralyzed humans to walk again. The Silicon Valley company, which has already successfully implanted artificial intelligence microchips in the brains of a macaque monkey named Pager and a pig named Gertrude, is now recruiting for a clinical trial director to run tests of the technology in humans in order to further develop the product. Almost 2 years ago, Dennis DeGray surprised his friend with an odd text message that he had sent. He remembers the message being something along the lines of, "You are holding in your palm the very first text message ever transmitted from the neurons of one mind to the mobile device of another. You have literally just created history." Since his unfortunate accident more than 10 years ago, DeGray, who is 66 years old, has been paralyzed from the collarbones down. Because he had 2 tiny squares of silicon with protruding metal electrodes surgically implanted in his motor cortex in 2016, he was able to send the message. The motor cortex is the region of the brain that regulates movement. These capture the activity that is occurring in his neurons so that it may be translated into action on the outside. He is able to pick letters on a screen by believing that he is operating a joystick with his hand. This allows him to move a cursor. In addition to that, he has used the power of his thoughts to make purchases on Amazon and to control a robotic arm so that it can stack blocks. DeGray is a participant in the BrainGate program, which is a long-running multi-institution research effort in the U.S. to develop and test novel neurotechnology with the goal of restoring communication, mobility, and independence in people whose minds are fine but who have lost bodily connection due to paralysis, limb loss, or neurodegenerative disease. As part of this program, DeGray has been implanted with these devices, which are known as Utah arrays. This is because the BrainGate program. However, despite the fact that the Utah array has demonstrated that brain implants are possible, there is still a long way to go until the technology is perfected. In order to put his, DeGray underwent an open brain operation. The device is not wireless. Instead, it consists of a socket that protrudes from its head and wires that run through it to computers, where the signal is then decoded by machine learning algorithms. Because the system only records a few dozen to a couple of hundred neurons out of an estimated 88 billion in the brain, the kinds of activities that may be done and the degree to which they can be carried out effectively are both constrained. Each electrode typically records from between 1 and 4 neurons. According to the advertisement for the position in Fremont, California, as the clinical trial director, you'll work directly with some of the most inventive doctors and top engineers, as well as working with Neuralink's initial clinical trial participants. You will lead, as well as assist grow, the team that is responsible for supporting Neuralink's clinical research operations and building the regulatory relations that come with working in an environment that is always changing and moving at a rapid speed. Last month, Elon Musk, the richest person in the world with an estimated wealth of $256 billion, stated that he was cautiously enthusiastic about the possibility that the implants may enable tetraplegic individuals to walk again. "We hope to have this in our first humans, which will be people that have severe spinal cord injuries like tetraplegics, quadriplegics, next year subject to FDA approval," he said at the Wall Street Journal's CEO Council Summit. "This will be people that have severe spin cord injuries like tetraplegics, quadriplegics." I believe that there is a possibility, using Neuralink, of restoring full-body functionality to a person who has suffered a spinal cord injury. The Neuralink system is performing admirably in monkeys, and we are now conducting a great deal of research and testing to validate its high level of safety and dependability, as well as the fact that the Neuralink implant can be securely removed. On the other hand, Musk has a track record of exaggerating the rate of the company's progress in the past. He made the prediction in 2019 that the gadget would be surgically inserted into a human skull by the year 2020. Musk stated that the gadget would be implanted flush with the skull and would charge wirelessly so that the user would seem and feel completely normal. He said that those listening should consider the technology as being analogous to replacing damaged or missing neurons with circuits. Next year, when we put devices in people, it's difficult to have sophisticated talks with monkeys, he continued. We will see a significant acceleration in our progress. An earlier video from Neuralink demonstrated how a monkey that had been implanted with the chip could play the computer game Pong using only its mind. The footage was made public in 2013. The company, which counts Alphabet, the parent company of Google, as one of a series of well-known backers in Silicon Valley, is also recruiting for a clinical trial coordinator to help build a team of people to run the trial and liaise with regulators. The company is also recruiting for a clinical trial coordinator. In the application process, prospective employees are informed that they will have the potential to change the world and work alongside some of the smartest and most skilled professionals from diverse sectors. By the way, guys, have any of you watched the Upgrade movie, which was released in 2018? Now you may wonder why I ask this. Well, honestly, this movie represents the good and bad sides of projects like a Neuralink. Back to our topic, so is there any option than getting implants? It's possible that the idea of the wearable, a non-invasive brain-computer interface that doesn't require brain surgery and can permanently be removed from the head, appeals to you. However, the reading of neural impulses is made more difficult by the skull. Cynthia Chestak, an associate professor of physics at the University of Michigan, notes that the physics of a non-invasive device is just really tough. Still, there are certain businesses that are making an effort. Facebook said in 2017 that it planned to develop a wearable gadget that would enable typing at a pace of 100 words per minute using only the user's brain. As a comparison, Neuralink is striving for 40 words per minute, which is around our average typing speed, and the BrainGate program, which uses Utah array implants, has achieved about 8 words per minute, without word prediction. In July of this year, researchers at the University of California, who were funded by the social network, showed for the first time that it was possible to decode a small set of full spoken words and phrases from brain activity in real time. However, in order to accomplish this, so-called electrocorticography, electrodes had to be surgically implanted on the surface of the brain, which was an invasive procedure. In the meantime, the company is continuing to investigate methods by which it might accomplish the same thing without resorting to invasive procedures. Specifically, it is investigating the possibility of measuring shifting patterns in blood oxygenation using near-infrared light. Active neurons consume oxygen. Kernel, a startup business located in Los Angeles and established by entrepreneur Brian Johnson, who previously made millions selling mobile payments company Braintree to PayPal, is also a defendant in the lawsuit. Kernel, a startup in which Johnson has invested $100 million, initially focused on brain implants but then shifted its focus to wearables because, in Johnson's opinion, the path toward intrusive technology appeared to be too long. There is a plethora of non-invasive techniques available for monitoring and stimulating brain function. Indeed, they form the basis of a large consumer neurotechnology industry. However, according to Johnson, none of these options compare to being able to bridge into a next-generation interface. It is necessary to find new approaches, and he feels that Kernel has discovered one that other people have overlooked. He predicts that by the year 2020, we will be ready to disclose more. And that's it for today, guys. We sincerely hope you enjoyed the video. If so, please click on the like button and share it with your families and friends. If you have any questions or comments, please share them with us in the comment space below. And don't forget to subscribe to our YouTube channel to see even more of our incredible videos. You can also check out our other videos that have been specially selected for you. We'll catch up in the next video.